in person at the First Unitarian Universalist Church, and I would like to express my thanks for the first few use to make the building available for our use by the Global Learning Center free of charge. So that's very nice. Thank you to everybody who showed up in person or on Zoom. And welcome again to the event tonight. We are going to have a presentation by Sandra Fatumi, and she's Fatuma, I'm sorry. She is going to talk about sickle cell disease in the Democratic Republic of Congo, where she is from. She's currently pursuing a graduate degree at Basel College, and then plans to return to Lubumbashi to open a clinic to treat sickle cell disease. And so she'll tell us all about that. Thank you very much for preparing this talk, and please, everybody, help me welcome our speaker tonight.
Thank you so much. And thank you for the presentation, Olga. And as he said, my name is Sandra, and I graduated from Southwestern College with a biology degree. That was kind of change of path. And then now trying to pursue some grad school in a combined program of public health and physician assistant. And of course, I never wanted to go that way because I wanted just to be a biology teacher. But with everything that had happened, I just felt like being called to something different. And as hard as it can be, I think I said yes to the call. Just a moment, or do you want to?
Oh, yeah, we should enable live transcription.
Okay. Okay, great. Thank you.
Okay, turn the sound a little.
Yeah, it's hard to hear.
Oh, the sounds.
Yeah, so speak up.
Cool. Can you hear me now?
Yeah.
Okay, great. So yeah, that's why I'm here. I think I said while I'm going into some other medical stuff. So today we'll be speaking about the sickle cell disease in the Democratic Republic of Congo, where I'm from. And the reason why I'm standing before you to speak about it, because it's kind of a very personal thing to me. And until now, I didn't know much about sickle cell disease. So you will you'll forgive me if I miss some other stuff. If we have experts here in sickle cell, that's fine. But okay, so I will talk about the overview and of sickle cell disease back home in Congo and the background of it. And I will also talk a little bit about the diagnosis and the current practices in the management of the sickle cell disease in Congo. And I'll also talk a little bit of the challenges. And then we'll get into talking about the work that we're trying to do back home to help in terms of just raising awareness and other stuff. So what is sickle cell disease? Sickle cell is a genetic disorder, a blood genetic disorder that one person can inherit from two parents who have had a mutation in their genes. And the mutation, when you have a mutation, it kind of affects your hemoglobin. You don't have a good hemoglobin. And then that's hemoglobin takes a shape of, instead of having a round shape, normally a good blood cell will have a round shape, but with sickle cell disease, you have like a croissant shape of your blood cells, and that creates a lot of complications in the patients because your blood needs to flow through those small vessels. And then if the shape is not flexible and not right, the flow will not be good passing through the blood vessels. So that's, in a very simple way, what sickle cell is. And then it comes from two parents. You need to have like two parents who are carriers of the disease. Like I am the carrier, but I don't have the disease. And then if I get married to a person who has the carrier, who's also a carrier, which means you get to have 25% of children who have the disease. And then of course you have 50% of those who are carriers and then 25% of someone who doesn't have even the mutated gene. So that's basically what sickle cell disease is. And then why are we talking about the Congo here? Because Congo is the third leading country in sickle cell, after Nigeria, India, and then comes Congo. And for now, the statistic in Congo is like 30% of population is affected by the disease. And when I say 30%, there are so many other factors that the country is not able to control. So the statistic might not be really right because of the other factors that we'll talk about later on. And then, oh, sorry, I'm going on the other way. So as I was saying, this is how the blood cells, the normal blood cells on the first figure looks like. They are round, and then the flow is so easy through the blood vessels. And then the second one, that shows the sickle shapes, and those sickle shapes becomes a little bit stiff, and when they, on the passage, they don't have a good flow and they can block somewhere, and then whenever there is a block somewhere, then which means there's no a good flow of blood, and that creates so many complications. So, and this is kind of the statistic of, it kind of gives us the whole image of the countries where sickle cell is most prevalent. In the United States, sickle cell is more affecting people of color, like African American, Asians. Of course, India is kind of the big thing. And then you also have some people from Latino countries where they are also affected. But right now, it has been shown that there's also a higher number that is almost really unknown of Caucasian having sickle cell. And that also creates other complications in the management here in the United States, because it's known as a racial or disease where it affects some people, not others. And then if you are white and you go to the hospital, you say you have sickle cell, it's kind of hard for people to believe that you have it. And it also creates some issues with those people. So this is a statistic from 2015, where it shows a number of babies that are born with sickle cell per year. And then the ones in red, really dark red, shows like we have almost like 10,000 to 100,000 babies born in those countries like Congo and India and Nigeria with sickle cell. And then some researchers have shown that sickle cell is becoming a global burden. And if we don't take care of that right now, it can spread out so badly around. So, well, these are the way that you can screen for sickle cell. This image here with a lot of cable, this is an electrophoresis. That's kind of the easy way you screen people for sickle cell in all different ways, but electrophoresis is the well-known. And with the electrophoresis, you can tell if someone has sickle cell or not. The downside with electrophoresis, it doesn't account for all the variants of sickle cell. We have different variants. And we have the SS, we have the SC, and then we have the beta thalassemia. So when you use the electrophoresis, you can the only results you can get are the S, either you are an AS or SS or AA, but it doesn't show the SC. And then this one it's like an assay test, immunoassay test, like a pregnancy test. This is what we call a sickle scan. It's a new rapid test for sickle cell. And the good thing with the sickle scan is that when you take the test, it kind of covered all the variants of sickle cell besides the beta thalassemia. At least it can give you the result that you need for whether you are an AS or AC or SC. And that's really important in the testing because you need to know what you are managing, like for the healthcare providers. So having a beta test kind of plays a very big role in the management of sickle cell. So since we are talking about Congo, I gave you all kind of the background of the sickle cell and then all the stuff, the testing and so on. Let's get into how is it cared for in the Republic Democratic of Congo. First of all, the only test that we have in Congo is the electrophoresis. But again, not so many places have the electrophoresis machine. And that makes it hard. And the only thing the healthcare providers can do back home is when someone comes and they suspect that it's sickle cell, they send them to do what we call the MO test. The MO test is like, they just do the count of the sickle blood cells that you have, like those misshaped blood cells. So like for my daughter, they did like just the counts and they said, oh, she has 30% of the sickle cells, the sickle blood cells. And then that doesn't say much. You don't know if this person has the disease or not, because as a carrier, somehow I can have a little bit of those depending on the level of my S gene. So it's kind of a little bit complicated. And then if you are lucky, then you go to a facility where they can do the electrophoresis. And then again, you only get to know if you are an AS, SS, or AA. So if you are SC, you don't get the chance to know. And then the electrophoresis will say AS because it can't see the C. And then an SC also has sick as an SS. So that's how it works, at least in the Republic Democratic of Congo, in so many areas. So the clinical management is always the protocol that they have right now. So it's like SS will take folic acid because it's known that a person with sickle cell has deficiency in folate. So folic acid will kind of help boost that. And then there is also hydroxyurea. Actually, they don't take really hydroxyurea, they took hydrea, which is the generic of hydroxyurea. And then it's just like a very minimum percentage of people who can access to that. And then there's also blood transfusion, which also after so many studies, there are so many discussions over like do we really need the transfusion, because it's also creating some other issues to this. And then there's also penicillin prophylaxis and vaccines, which also is really scarce right now. And so when speaking with the healthcare providers and then just having those moments, exchanging what is going on around, we just realize like there are so many challenges. There are so many people who cannot even afford the folic acid, which is really almost free. Because from what I heard, for a tablet of almost like 20 pills, it is less than $0.1. So it's really cheap, but there's a big population that cannot afford, because it's something that you take every day. Your child should take every day. And then the other thing in terms of the challenges in terms of management is the hydroxyurea, which is a very good medication for now, up to now, because in the United States, people have been taking it until now that they are different kind of medications. But this is the one that helps a lot, because what the hydroxyurea does, it kind of help the patient produce the fetal hemoglobin, which is when a sickle cell child is born, the first 6 months, they are those months where the child hemoglobin is being produced, and they are good hemoglobin. It's a good blood cell and doesn't create so many issues until after 6 months, where they lose their immunity from the womb, and then they're exposed to all these infections, and then also the production of the fetal hemoglobin is kind of reduced. So hydroxyurea kind of helps with the production of the fetal hemoglobin, which also leads to decrease of different crises, because when you have good blood cells, then the flow is good and you don't have any crisis. So, and then there is also, but this medication is also scarce at home, because not everyone can afford it. And then most of the time, people have been telling me that they go around in all the pharmacies, you don't find it anywhere. And that's kind of very surprising. And then you have the penicillin, which is also very important so that it can protect the people from infections and all that. And it's also not very expensive, but some people cannot afford it. The vaccines are the most important, because when you take a vaccine, it prevents the child from, or the person from getting streptococcus and pneumonia and all that, because sickle cell patients don't need infections. When there's just a small infections, that can lead to so many crises. So the vaccine kind of helps so much. There are a number of vaccines that are given, and I can tell you, they are very expensive. And right now they are telling me that those who are taking care of sickle cell patients are saying that they are nowhere to be found right now. And they go from $50 to $100. And then some you take them every 3 months, and some you take them every 2 years, and then some you take them after every 5 years. That's kind of a very important piece that we are not having. So I'm already getting into the challenges that are presented back home in terms of sickle cell. So we have insufficient use of standard care practices. There is a protocol that has been put in place for the sickle cell back home, the treatment protocol. But talking with healthcare providers and so many physicians, they said, we don't have it, there's no kind of an office where you go to and find all the information. And then if you have $50, then if you are in the family of 6 people, then $300 just for testing. So there's lack of better screening. And then the other challenge that we have is education. Up to now, sickle cell is seen like a witchcraft disease. If someone has it, there's a lot of stigma around it, and then it's like, this person has been bewitched, or it's coming from the mother. And most of the time, it's the woman who will be stoned in terms of this. And then the other thing is the disease, although the disease is very high in those countries, but it's not regarded as health priority. And that's also kind of not really interesting. And that also leads to lack of better management of it, because if you don't take it as a priority, how as a government can help people into that? And then there's lack of dedicated and well-equipped health provider. That there are people, so many physicians back home who don't know how to manage this. And then I can tell you, when my daughter had a crisis, he was seen by a person who didn't know that she had sickle cell. And then whatever treatment they did, they didn't take in consideration that she was a sickle cell patient. And then they just treated. And then somehow, I still believe that that contributed to a lot of complications. So, and then there is, like, in terms of those who are affected by SC instead of SS, there is, even for both, because there's higher risk of a sickle cell patient to have a stroke, like so many times. And then there is lack of, like, the transcranial Doppler, which helps to detect the risk of stroke in a sickle cell patient. So those are kind of the challenge. And why am I talking about the challenges? Because these are the things that we want to look into and then see as a community and population how to deal with. This is my daughter, Chrisma. She passed in 2017, September 13, 2017. She was 6 years old. She is so beautiful. And she was a very great daughter. Of course, every mother would say, my child is great. She had a very strong personality. And then she was very compassionate. Her favorite place to play was going to the orphanage, playing with the kid who didn't have parents. She was a sickle cell. She had sickle cell disease. And then, as I was saying, she had a vaso-occlusive crisis. And then she was taken to a nearby center clinic. They didn't know what was going on with her. And then I don't know how they made in place their protocol to treat her. And after a few hours of her crisis, she passed. And this is why I'm standing here, because there are so many things that I didn't know when I had my daughter about sickle cell. Yet she was sickle cell, but I didn't know so many things. And then right now, I wish if I'd known those things, maybe we could have prevented so many things again. This is my cousin that I dearly call my brother. He passed a few years ago. He was a very funny person. He had a great sense of humor and always would be there when he didn't want anyone to be mistreated. If you do something which is not good to someone, he will call you out. He really wanted to leave. He was also sickle cell. And he had a crisis, and he didn't survive to the crisis. This is a cousin of mine. He's 14 years old now. He's still alive. And anytime I'll call her mom and talk to her, and she'll tell me what they are going through. He is a fighter. No matter what's going on, he stands and believes that one day there will be a solution for him. His name is Anemia. I don't have a picture for this one. Roxanne. She's a friend of my daughter. She passed last year. They took their child to India for a transplant of the bone marrow because they didn't have any solution locally. They had to pay a lot of money to go to India. And they made it to India, and she had a bone marrow transplant. They went back home. She got an infection because she was just coming from a transplant. And then that infection was not well managed, and she passed. Why I'm telling all these stories, there are so many that I wanted to bring. And then for Roxanne, actually, her family have been gone through that 3 times because 3 of her brothers died before, and then she was the 3rd person to die from the family. I'm not saying like people will not die, they will, but what is so painful is it feels like we are not trying to help those who need the help. So that's what leads us to talking about what we want to do. After all these stories, after all my pain losing my child and seeing what's going on and learning and reading a lot about this disease, I just realized I failed my daughter. I did fail my daughter. The community did fail my daughter. The government did fail my daughter. We all are failing these kids because I just feel like we didn't try enough. And that's what led us to think of starting an organization called Sickle Cell Christmas Foundation. And what is it that we want to do? We want to help people to access to a better screening. The sickle scan that I presented you with, that kind of shows all the variants of sickle cell in testing. If we are able to get those ones, we can bring the screening from $50 to at least $5. And then if everything is well, we can even have them for free. And that's the first thing, because early testing has shown that in the United States around the 1970, when they introduced the early screening, it's dramatically reduced the number of deaths and then increases the life expectancy in sickle cell. Because when you get it early, you can manage it early. So this is one thing that we want to do. And for your information, in the United States, the rate of survival is now to 91%. And then back home, the rate of survival, and in other African countries, it's like 10%. So a child cannot go up to, most of the children, 50 to 80%, they die before 5 years old. Mine died when she was 6, and my cousin died when he was 13, and then Roxanne died when she was 14. So the life expectancy back home is like 15 years old. And then in the United States, it is 60 years old, 50 to 60 years old. So that's a bit different. And then what helped a lot was the early testing. So that's also the first thing that we want. And the second is to educate the population in terms of stigma, and then just let them know, what do you give to a sickle cell patient? what kind of food and all that. I didn't know so many of those when I had my child. And then the other thing that we want to do is to be able to make available those medications that kids need. I've been part of different organizations, sickle cell disease here in the United States, and it's kind of inspiring, not only in the United States, but Australia is doing a very good job with that as well. So I just believe that we can also do that. And then if we get people who hear that there is needs, because there is a very high level of migration around the world. So it's not just like an African thing, it's a global burden right now. As I said from the beginning, that from the researches that were done this year, it's becoming a global burden. And then if we don't do anything about it, the numbers are going to grow and grow in terms of sickle cell patients. And so those are our goals, to bring a cheaper test and then to make available the medicine that's needed, and also to bring the education to the people in the communities and have the conversation to start. Because I was ashamed when I couldn't tell anybody that my child was sickle cell. When we got the diagnosis, my husband and I couldn't tell my family-in-law that our daughter was sickle cell, because it's kind of a shame. And then people were telling me, why are you so sad? You knew that she would die. I don't want sickle cell to be like a death sentence. We can do better than that. Of course, people will continue to die, but let us prevent what we can. And then if they go, then we'll say that we tried at least. And what our way forward, of course, is to establish a clinic to take care of the sickle cell patients. And then I just also want to take the opportunity to thank the people who have been with us in this fight, the Medical Loan Closet here in Wichita, Lloyd and Ellen, thank you so much. And the Southwestern College Leadership Program, they have been very supportive of this program. And the Hof and Grand Trinity Lutheran organizations that sends medical equipment home. The Medical Loan Closet is helping me put together medical equipment that will be shipped home so that we open the clinic. And I just want to take the opportunity to thank them for that. And then that's where I end my long presentation. And if there are any questions, I'll be open to answer them. And then people in the Zoom, yeah.
Thank you. That was such an interesting presentation. If we have questions from the audience here, please, and also on Zoom, if you just unmute yourself and you can also speak up. I think we have one question here. No.
Sandra, talk to them and tell them about the people you talked to in North Carolina that have a test for a low cost, but it tests so thoroughly.
Yeah, so I thank you, Lloyd, for that. It's called the Sickle scan. It's like a rapid pregnancy test. I showed you I've been in touch with the organization. As I was saying, our goal is to bring the testing from $50 to at least free. So I got in touch with the Biomedonic, that's how they call themselves, in North Carolina. They produced the Sickle scan, and they were ready to give us to provide the Sickle scan to a very cheaper price. Like they wanted to give us to almost $3.75 per kit, which actually kind of meets our goal. If we have it for $3, we can at least put it back home for $5, which kind of makes a big difference from $50 to $5. And then if you have a family coming, a family of 6 or 10, then they don't have to spend like $300 for a test. They can spend less in that. And the company in North Carolina is ready to supply us with as many as tests that we need. And that will be a life-changing, very much. I've been talking to physicians back home and they're like, we are waiting for that. So everyone is rooting for that so that we can make it like mandatory to every parent to have their children tested when they are born. And that will really change a lot of things. So yeah, thank you. That's the biomedonic.
Also explain to them when they get the test, there's like, you learn the 4 things about yes, you do, no, you can't, you're a carrier, you're not a carrier.
Yeah, so the test will show whether you are a carrier or you have the disease. And then if you have the disease, what type of disease that you have. Do you have an SS, an SC? Of course, the beta thalassemia, it's again another test that we need, but at least it will give us the most prominent disease that are present back home, because thalassemia is really big on the on Asian, of course, and then not really big like back home. Yeah. Yes, sir.
Yeah, is it possible for a person with sickle cell, who's done right for them to live a normal life?
And could you please repeat the question for those on Zoom?
Oh yeah, okay, those who are on Zoom, the first question I was asked was to talk about the rapid test, the Sickle scan, and then the company that is making those tests, and then the conversations that we have had with them to see in what way they can supply us with those Sickle scan. That will bring the price from $50 to at least $5, which will be a little bit much affordable for the people in the Democratic Republic of Congo. And then the question that just came in is it possible for a sickle cell person to live a normal life? It is possible if everything is put together, because there are different factors that get into consideration for a person with sickle cell. Nutrition is one of the most important things. And then access to a better environment. And then of course, the clinical management of the disease. And so if the person has a better education of the families, how to care for their patients, they can definitely live a better life. What I'm saying, if a patient has hydroxyurea regularly, it's really lower the number of crises. A person will go 3 years without any crisis. So this is like something very important. And also if they have taken their vaccines, like my daughter never had so many crises somehow, but we get to a point whereby if we manage it well, better environment, good nutrition, and a lot of education, a sickle cell person can live a normal life. And we have so many examples. I met people here in the United States who are 80 years old, sickle cell. They have children and grandchildren. And back home, when you say someone is sickle cell, it's like they will never have children. They are prone to die and all that. So it is possible, yes. Yes, ma'am?
Is it possible that sickle cell, one of the reasons of clotting the blood?
Of clotting blood?
She'll repeat it.
Okay, there's a question here that says, is sickle cell one of the reasons for blood clot?
No.
If we look at
No.
what we said, someone is speaking.
Stop moving.
I don't mind, man.
Jim and Dottie, you can ask a question in a minute, please. Let's address the current question first. Okay.
So not necessarily, that sickle cell is a cause of blood growth, but as we are saying, sickle cells kind of affect every part of where blood goes. Like it affects every area of your part of your body where blood goes, your eyes, your teeth, everything. So it can be a cause of so many complications, health complications, but not necessarily like the blood clot. Any other?
Do we have questions on Zoom? Maybe let me also.
One more back here.
Yeah.
Okay.
Yes, sir.
Apologize for my late entry. I just did
That's
an
okay.
introduction. Question about sickle cell. Is it located in a specific area or disseminated widely throughout the nation and for that matter, the continent?
It is spread out all over the African continent. And then it's not only located in one specific area, but also the percentage in each country varies. As I was saying, no, you were not there. Nigeria is the #1 country that is very affected, followed by India. And then the Democratic Republic of Congo account for the 3rd country with more sickle cell.
West Africa after those three?
Sorry?
And then West Africa, like.
Yes, yeah, the whole sub-Saharan Africa is also very affected. Actually, we have every year for the whole sub-Saharan African countries, we have 400,000 babies that are born with sickle cell every year, I mean, yeah.
Second question,
Mhm.
Given that Congo is estimated to contain mineral and metal stores
Mhm.
valued in excess of $24 trillion, do any of the big mining corporations like Glencoe contribute significantly to the research or funding or testing, etc.?
That's a very good question, actually, sir. I have a question here. The first one was how the account of sickle cell in Africa, is it just in one place or in so many other places? And then, as I say, that's from the beginning that we have Nigeria, India, and then most of all Africa, and then some Latino countries that are affected by that. And then the second question that I'm just getting is like, is it possible to have like big mining companies? Because Congo is known for a lot of mining, and then we have so many investors who are coming down for the mines. And then he's talking specifically about Glencoe. He has a very big company. They have a very big company, a mining company. If we can have them be part of the fight against sickle cell, and I think that's a really great question. And absolutely, that's also our aim. Like when we get back home, of course, they are not very engaged in the fight of sickle cell, and somehow it's not their fault. It has to be the government program. If the government sees it as an issue, of course they see it as an issue, then they have to come up with a program that need to be implemented, as we have done with malaria, for example. And then from there, we can have those companies to come. And that's also the aim of the organization that we are creating. How do we get as many people involved? Of course, it's not an easy task. But
your mention of malaria is also interesting to me personally, having had both 5X and falciparum at the same time. And I know that malaria causes pathology and a process similar to sickle cell in terms of the congestion of the partially eroded or the elliptical blood cells in smaller and smaller capillaries.
Yeah.
Painful enough in the muscles.
Absolutely.
Extreme pain.
It is.
But critical in the areas of the brain and heart, of course. And I wondered if there was a concomitant correlation of testing and whatnot and prevention process between the two diseases?
Okay, there are some researches has shown that, okay, he's asking about the correlation between malaria and sickle cell. And then in the process of testing those disease. So there have been some researches that have proven that the carriers of sickle cell have a better prevention of malaria, against malaria. But lately, it has also brought so many discussions in the scientific world. Is this the reason why we can't fight against sickle cell? Do we want to keep the carriers? But okay, these are the kind of the questions that are going on. But it has been shown so far that if you have malaria, you are a carrier, a sickle cell carrier, then you are kind of you have a better prevention against malaria.
Does it work the other way?
The other way, no, it doesn't. Actually, you want to make sure that a sickle cell patient doesn't get malaria, because malaria comes with fever and all these symptoms that will lead to more complications into a sickle cell patient. Because once there is a fever, then the hemoglobin goes down and everything leads to so many complications. So when someone is sickle cell, you don't want malaria with a sickle cell patient.
I found it also interesting that Canada, the headquarters for about 20% of the mining corporations in the Congo are headquartered in Canada.
Absolutely, we have been just getting all the information about all that. It's a very interesting thing, and then this is where also the mind is going. How do we get all those people involved? Because right now we can say, oh, it's an African thing or an Asian thing, but the migration is just so big. It's not now you can't stop anyone to go anyway. So it's something that we really need to take into consideration. Any questions from the Zoom?
Okay, I am Dr. Ahmed. Sorry, may I interrupt? I am one of the hematologists, so my part of my job is to manage sickle cell disease patients. A quick question about Congo. You might have mentioned about one of the major aspects of managing the sickle cell disease patient is exchange transfusions. So how much does it cost there, and how do you manage that back home? Is it costly? Is it easily available? And are there any difficulties?
Oh yeah, absolutely. This is a really great question. I was just discussing with one of the doctors. She was supposed to join us, but unfortunately her child had a crisis. She's sickle cell. She's a physician that's kind of taking care of so many sickle cell patients as well. And one of the things that she told me is Sandra, if you want to bring a change, the first thing is early testing. And the second is make sure that you have a blood bank, if I can say that. Can you say that in English?
Yes.
Yeah, a blood bank, because that's scarce. It's expensive, and it depends also on in areas, but most of the time, in the place where I come from, if a child needs transfusion, it should be $25 to $30, which is really expensive because most of the populations back home is really poor. And then if they need a certain number of units, that becomes even a big financial burden to the people. And then back home, again, one thing that we want to work on is how do we get people to donate blood, because it's not a culture that people do, something that people do oftentimes. So that also is a big issue in terms of transfusions, because there are just not so many blood banks, and then people are not ready to give. And then another challenge about the blood is that even if there's no blood that has been well tested, there is blood that's coming from a relative member. And then the way they do it, they don't have the equipment that's needed to test that blood. So it comes from one person to the sickle cell patients. And then it's just later on that we realize that there are so many complications. So that's a big problem. That's also one of the big challenges that they are facing, because blood is not tested. They just get from one person directly to another, and then whatever it comes with creates again more problems to the patient. Yeah, that's really a great question. Any other?
Yeah, so you have made a very convincing case that there is a big problem and that there also can be solutions by comparing to what is happening here in the United States, and hence that we should open a clinic. But how does one go about that? You mentioned some resources like the medical law closet, and that some company wants to provide some of the drugs that are needed in an inexpensive way. But there is so much more to get a clinic started. So are you working with people to raise funds, or are you just starting very small and then growing, or what?
Yeah. So the question here is like, there are just so many challenges, and then Mr. Holger is asking, what is it that we are putting in place? Beside the medical loan closets, it has given us the equipment to start the organization. And then we have the orphan grain train that is helping to ship the container. And so he's asking if we have other people involved into that. To tell the truth, we don't really, beside the people that I just listed, and then the biomedonic that is ready to kind of go with us. And of course, they're not giving us the sickle scan for free. We have to pay. And then since we don't have any sickle scan back home, which means we just need like a very continually supply of sickle scan. So yeah, we really, and then we are also trying to be in conversations with some pharmaceuticals like Novartis. They have a product which is working also well for sickle cell. Instead of just hydroxyurea, how can we have the other medication that have been approved here in the United States, like Endari or Adevco, I think I'm saying well the name, and all that. So that needs like a work of so many people. And then to say the truth is we don't yet have, like, we haven't built that network of people who can chip into that and help towards the mission that we are doing. I don't know if I answered the question.
Yes, thank you.
Yeah. So again, if anyone wants to be part of this, just taking the opportunity, you can get our contacts and then contact us, and we'll be so grateful that you are joining us in this fight. Any other question from the Zoom people? Wow. Okay.
It looks like we don't have any other questions now. So thank you again for such an interesting presentation tonight.
Thank you for having me, and thank you for being here. Really appreciate this. Okay.
Thank you. And the Global Learning Center will have more events throughout the next couple of months until May. We have one event firmly scheduled for November. That will be by Bob Waldner on endangered environments. That will be the Sunday evening before Thanksgiving. We may also have another event before then. Traditionally, the Global Learning Center hosts the United Nations banquet in October. but we are still planning for that and are not certain of the details yet. So please watch out for email updates on our upcoming events. Thank you. Have a good evening, everybody. I'll stop the recording and